Acting Commander of the Royal Bermuda Regiment. Good afternoon. Today I will start with a COVID-19 health update and then provide some context around the national address, which I'm sure that most persons have been able to listen to that I gave earlier this afternoon. Minister Keynes will discuss the results of the meeting of the EMO earlier and will also provide details of the operational aspects of the shelter-in-place measure, which was announced earlier today. Regarding COVID-19, I can confirm that there were 8 results that were received today by the Ministry of Health, and there are no additional positive cases to report. Our total number of confirmed cases remains at 32 persons. As I mentioned last night, there were 3 cases that were under investigation. 2 of those cases which were under investigation have been confirmed as close contacts, and a 3rd remains under investigation still. As of this afternoon, there have been 236 tests that have taken place, and there are 33 results which are still pending, 171 negative results, and as I mentioned before, 32 confirmed cases. Out of those 32 confirmed cases, 20 were imported, 11 were limited local transmission, where we could trace the contacts, and 1 is still under investigation. It is important to note that 10 persons have fully recovered from their infections, while 3 remain hospitalized in stable condition. We currently have 1,488 persons who are under self-quarantine with public health supervision. Earlier today, I gave a national address stating that from the 4th of April at 6 a.m., Bermuda will implement a shelter-in-place measure for 14 days. The shelter-in-place is scheduled to end on April 18th. The decision to move to shelter-in-place was not taken lightly. We looked at the number of confirmed cases in Bermuda. We listened to the guidance from the Chief Medical Officer, who is closest to the situation. With COVID-19, there is uncertainty, and decision-making is tough and will always be second-guessed and will always be questioned. I recognize the incredible pain that this will cause in our community, both financially and certainly emotionally, and how unpopular this decision may be in certain quarters. However, the pain will be nothing compared to the pain that we will have if we have an overwhelming of our healthcare system, which will lead to a number of deaths. We have seen it play out on television overseas, and it will be a violation of our public duty if we do nothing to prevent that from happening here. This government will always make decisions that are in the best interests of the health and welfare of those of us who live in Bermuda. So what does shelter-in-place look like in practical terms? It means that the only businesses that will remain open are food producers, such as farmers, fishermen, and those persons who raise and herd livestock, food wholesalers, retail grocery stores, doctors' offices and medical facilities, pharmacies, gas stations, the ports, utility companies like gas and water will be available for emergency service, and banks on restricted hours to only provide the most essential of services. Local banks have been designated as essential services. However, all face-to-face interactions between bank customers and bank employees will be suspended for the 2-week period. Bank office operations include the servicing of ATM machines and the processing of wire payments, among other things such as online banking, will continue. The purpose of this 14-day shelter-in-place is to restrict the movement of people to ensure that our healthcare system is ready for any future surge in patients. It is a big step to ask persons to stay on their properties, to close beaches and public parks, but it is essential that we restrict movement to ensure that we contain and constrain any possible outbreak. People will be allowed to exercise outside of their home within reasonable distance with no more than groups of 2 for restricted times. Minister Keynes will provide additional details when he speaks, and the police commissioner, as well as other officials, are here to answer any further questions. It is essential that we remember that this is a time that we must all pull together, and we must all do what is right for ourselves, for our families, and for our communities. We must work together and treat each other with kindness and respect. There are a number of stories that have come to me regarding landlords, both commercial and residential, who are not understanding the need for compassion during this particular time, and who are demanding rent from those persons who have been let go from work and are threatening eviction of people who, from no fault of their own, can operate their businesses and cannot pay the rent on their home or their apartments. To these unscrupulous landlords, I say, today, the courts are closed and eviction notices will not be processed. This is a time for unity, and it is not a time for us to turn on each other. I want to touch on the airport and when it is scheduled to reopen. We closed the airport to schedule commercial traffic for 2 weeks, commencing on March 20th, 2020. The fact is, however, that due to the global situation, we have been informed that there is no commercial air carrier that has regular service to Bermuda that is intending on recommencing flights until May 1st, 2020. It is important to note that this is not fully a decision of the government of Bermuda, but also of the air carriers which are flying. This does not prevent our efforts to continue the work to bring stranded Bermudians home and ensure that there are adequate quarantine facilities in which to house those persons to minimize the risk of any future outbreak. Before Minister Keynes comes to the podium, I want to remind people that you have time to get your home in order before shelter in place goes into effect on Saturday morning. You do not have to run out and start panic buying. Remember, grocery stores will open during the 14 days that we will be sheltering in place. And in addition to that, all major grocery store chains have confirmed that the traditional Wednesday 5% discount will be in place during the entire duration of the shelter in place. I want to thank the employees of our grocers who are doing stellar service while they are on the front lines. Our ports will be open for goods, and goods will continue to come to the island. If you run out of necessary items, you will still be able to purchase them. So I will encourage you over the next few days to operate and do things in a good and decent order. We have the opportunity to show each other our best, to be our best, and we must show kindness to each other and exercise the patience of which this time requires. While we cannot touch or hug each other, we can share a smile, exchange a warm greeting, check up on your friends, possibly repair those relationships from a distance which have been frayed, and go the extra step to be a friend, because that is the only way that we will get through this tough time together. I will close my remarks by saying I want to again pay tribute to all of those persons who have answered the call of service. I was particularly gratified that after my press conference yesterday, I received WhatsApp notices from public officers who made sure that they prepared themselves to drive nurses to the hospital earlier today. This is a time when we can all come together. As I said earlier, COVID-19 does not discriminate based upon age, does not discriminate based upon race, does not discriminate based upon economic status, does not discriminate against political party, and does not discriminate against immigration status. If there was ever a time when it was about all of us being in this together, it is now. I recognize that the times will be difficult, but I will call upon all aspects of society to not only ensure that we endure this next painful period, but we write the next chapter of Bermuda's history, which will be one of success collectively as we seek to recover from the damage that this crisis right now will cause, but certainly will not have to endure if we do what's necessary and right. Thank you, and now I will turn the podium over to the Minister of National Security. Minister.
Thank you, Premier. After a meeting this morning of the Emergency Measures Organization's operational subunit, the following was decided. We would like to highlight that a state of emergency allows the population limited movement to conduct essential tasks. Any departure from their property, from a person's property, can only be to purchase goods or for the collection of essential medications. There will be a 24-hour shelter in place from 6 a.m. Saturday, April the 4th. Persons who are confined in their places of residence during the 24-hour must be confined in their places of residence for the 24-hour shelter in place. The time period will be reviewed and may be extended. Although comprehensive, it is not exhaustive, and the procedure for someone to apply to leave to their residence will be outlined. The protocols will change as the Governor and the Cabinet review the situation in consultation with the Chief Medical Officer. During the times of essential movement, everyone must practice social distancing of 6 feet between persons. There will be limited movement during the day for essential tasks. Persons will be permitted to exercise by foot, no more than a half a mile from their properties. Exercise should be only in groups of 2. Beaches and parks will be closed. The people below are exempt in accordance with the law. The Bermuda Police Service, the Royal Bermuda Regiment, the Bermuda Hospital Board employees and their essential contractors, Emergency Medical Services, the Bermuda Fire and Rescue Service, the Bermuda Customs Department, the Bermuda Immigration Department, the Department of Corrections, the Disaster Risk Reduction and Mitigation Team, medical and paramedical professionals, pharmaceutical companies and pharmacies, caregivers, nurses, orderlies, doctors, clinics and pharmacy workers, private doctors, veterinarians, public media services, radio stations, social media, cable companies, newspapers, and interpreters. Alifwade International Airport services provided to Skyport and their contracted agencies. BALCO, dock workers unloading and loading cargo ships, including the trucking regime that supports the aforementioned. Licensed private security guards. The removers and handlers of deceased persons. The Ministry of Public Works, Waste Management, and Water Treatment Plant, and all the supporting departments and contractors for the collection of storage, the treatment and disposal of sewage and garbage. Telecommunications providers handling landline, cell carriers, and radio communications. Brokers and shipping agents. Financial institutions and ATM service providers. fuel distributors and gas stations, farmers engaged in agriculture and livestock, fishermen, food distributors and supermarkets, restaurants for takeout service only, and food delivery services, collections, and delivery from registered voluntary and community outreach programs. In other words, restaurants will be open for takeout only, and only food delivery services such as Sargasso Sea will be allowed to make collections. Authorized government shelters, critical cleaning services and sanitation workers, hotels, villas, and ancillary staffs. Please note that game rooms, spas, gyms, tennis courts, and any other recreational services provided by hotels are not allowed. In-room dining only. All courts will function under the guidance of the Chief Justice and the senior magistrates. Again, persons must remain in the confines of their home during the curfew period. Churches, closed. Funerals should be conducted in cemeteries with a maximum of 10 mourners. Weddings are suspended. No social gatherings whatsoever. The general public are not permitted in areas designated as quarantine centers or homes where persons are under self-quarantine. Prisons are closed to visitations. All schools remain closed until otherwise advised by the Minister of Education. Visitation to senior citizens' homes are not permitted. Visitation to hospitals are limited to essential visitation only. The purchase of groceries, they should be performed by one member of the household to minimize social interaction. Groceries should not be bought more for a period longer than 7 days. Individuals perceived to be purchasing in bulk or excessively will be challenged and potentially not be able to purchase the aforementioned goods. Groceries should only be purchased at the nearest available store to the family home. In other words, if you live in Somerset or Bowes Island, you should purchase your groceries in the West End. That goes for the middle parishes and the Southampton parishes, as well as the central and the eastern parishes. You will be advised to purchase groceries in your area. All recreational spaces, including beaches, parks, and etc., will be closed to the public. Again, the public should remain in the confines of their home and garden areas unless it is to travel for the matters that we specified earlier in the statement. Community advisory points will be operated by the Bermuda Police Service and the Royal Bermuda Regiment, and will be in operation across the island 24 hours a day for the 14-day period. Pedestrians and vehicles will be stopped to ascertain the reason for them being away from their homes. Unless it is for essential travel, as specified, or you are an essential worker, your names will be recorded and you will be directed to return home. Repeat infringements will result in the consideration for your arrest under the appropriate legislation. Bermuda, these are some very challenging times. We believe that we can get through them together. You might be alone in your home, but we are in this together. Thank you.
Before there's any questions, I'm sorry, Minister of National Security. There was one level of inconsistency in the list of which the minister had read out, which is an error. Restaurants, including takeout and delivery, are closed. To be clear, restaurants, including takeout and delivery, are closed. And I do not want that to be confused. The purpose of this shelter in place is to ensure that as few people are moving as possible. We cannot know whether or not persons may be, and what we're trying to do for these 14 days is to be able to stamp out any possible community transmission. So we have this as limited as absolutely possible. Restaurants and takeout services are closed. Sorry, Minister, just need to clarify that. Any questions?
Questions from the media?
Thank you very much. You mentioned that there had been some of the public officers had reached out to try to offer assistance to healthcare workers today. Are you, I guess, any further forward with minibus services that can take that on a more longer term basis, or is there an opportunity for other members of the public to offer the assistance? Is that something you would consider?
I'm hopeful that the situation regarding transportation can be resolved, and I'm certain that that work has been ongoing. I have not received the latest brief. What I'm saying is that in a spirit of making sure that we step up to the plate, there were public officers who have access to government-owned vehicles, which were not private minibus services, that made sure to accommodate those persons to getting our nurses and healthcare workers to the hospital early today, and I just wanted to pay tribute to them.
And with regards to healthcare workers, we're hearing some reports with regards to perhaps members of staff at the hospital that either have been infected with COVID-19 or are being tested for it. Can you confirm any of that?
I will happily hand that over to the Minister of Health.
Certainly.
Thank you. For obvious reasons, confidentially, we're not in a position to disclose who has or has not been tested. I think what's important to note is what the Premier has previously indicated is that we are testing quite rapidly. There are 32 confirmed cases. 8 results came through today that were all negative, but for obvious reasons, living in a small community such as ours, we need to maintain persons' confidentiality so that they can continue to have confidence in public health. And if I could just add one more thing with respect to the closures that Minister Keynes indicated, with respect to the hospital, it is closed for all visitations, save for end of life.
Thank you very much.
Thank you.
Thank you.
How are you going to monitor? How are you going to monitor for those that are traveling and they might say they're going to the store, the pharmacy, etc.? How are you going to really monitor their honesty?
Here's the thing, Trevor, and it's a very simple thing. The police have, Police Commissioner, do you want to speak to that? Go ahead.
Trevor, I think what we've got to reflect on is what's taken place already. The community advisory points have worked successfully with the public, and we are seeing a level of engagement and actually a significant reduction in the number of vehicles on the roads. Of Tuesday last week, we recorded over 1,000. By Thursday, it was down to 250. So the message is getting across. This is about working together, so we trust our community to work with us. So if there are elements of dishonesty, then we've got the powers to deal with that. And Bermuda police officers do know their community. They know people, they're able to engage. So I am extremely positive around the fact that this will work. We're seeing it working within the curfew at the moment, and I think we can make this work as we go forward. But of course, if people do ignore the advice, and if there is infringement, and if people behave in a way that's not consistent with government guidelines around health, then of course we can revert to powers such as arrest. We don't want to do that, we don't want to criminalise people, but there is a line in the sand, and we ask communities to work with us.
Thank you, sir. Minister, can we get a breakdown on the numbers of male-female ratio and age brackets? Is it possible?
The Premier... Goodness. There are, insofar as the 32 persons that have tested positive, 19 are male, 13 are female, and the range of age is between the years of 18 and 75 years old.
While you're still at the podium, Minister, the person that was tested positive on the American Airlines flight New York City on the 14th, The Premier said on Twitter the case was tested on March 28th, and this person arrived before the government urged air travelers to self-quarantine on March 15th, or legally required to quarantine on the 17th. Does that mean that this person was then out in the community for a bit before they were tested?
Well, the epidemiology, this actually was discussed earlier today with respect to the epidemiology and surveillance unit, and this particular individual did return to Bermuda. They became having symptoms a few days after their return, and then, which is why you would see that the test was taken several days after they had returned to Bermuda. But they had actually basically remained within their house anyway, notwithstanding that there was no mandatory legislative quarantine requirement, that they've just remained isolated in their own home in any event.
Yeah, so this person in that case did the right thing.
Absolutely, absolutely.
The BBC understands that there's a shortage of PPE worldwide. Can the community be enlisted to help in this matter at all by making masks, or is that not necessary?
Well, I can't say, as you rightly said, there is a shortage worldwide, but there have been quite an abundance of supplies that have been sourced, both in the United States as well as in Europe. We are anticipating a shipment to arrive on, initially was scheduled for the 5th, but we've been made to understand that the plane is leaving a day late from China, and it's coming direct to Bermuda, and it will have quite a substantial amount of PPE on it. We are also anticipating the BA flight next week from the Crown Agents, also having further PPE. I believe that's scheduled to arrive on the 6th of April, and we also have supplies coming through DHL also on the 6th of April.
Okay, thank you.
You're welcome.
If I may, just to add to that, because I think that it's an important point of which you asked. PPE, which is required in hospital settings, cannot be made by persons at home. And we've seen the situations of where persons have been seeing these things online and all the rest. And that's in emergency situations where, unfortunately, we have doctors overseas who are having to manufacture face masks from recycled bottles because they don't have any. We're fortunate not to have that shortage here in Bermuda, and that is part of the reason why we have to make sure that we implement this shelter in place so there is not any possible community spread that gets us to a point that we run out of PPE prior to the shipments coming in. I must pay tribute to the Ministry of Health and all those persons who have actually worked to try to source these particular items. And it has not been easy. And when we talk about the logistics of getting planes and all the rest, when there are so many larger countries that are trying to get this, but we have been incredibly resourceful as a government. We have reached out and used all the things. I thank all the persons who have written to us, who have said, we have this and all the rest, and many of those persons are followed up with, and it's enabled us to get to the point of where we are. And I think it's important. I think your question actually addresses the question of mask wearing in public and homemade masks, which may be able to be done. This was something that had come as a suggestion from a member of the public. I gave it to the Minister of Public Works, and I just want to give an update for the public at this point in time. It was supposed to be included in my remarks, but as I said, I don't want to keep you all waiting much longer, and we have had a relatively busy day today. There was a suggestion from a member of the public who suggested that we could help ourselves by producing our own face masks. Now, the key point, this is not for healthcare workers in PPE. It is not the type of stuff that you'll find inside of a hospital or healthcare setting. The Ministry of Public Works, I asked the Minister of Public Works who are coordinating the third sector support to liaise and assist in developing that idea. As such, the Minister of Public Works and the Permanent Secretary of Public Works have been corresponding with the member of the public, who is Ms. Sheila Tyrrell, and this week convened a teleconference with Ms. Tyrrell, Keisha Tyrrell, 2 ministry officers, Ms. Georgette Trott and Ms. Trina Bean, to lead this particular initiative. The team likes the model of the Czech Republic, where the entire country is involved in contributing to their own health. The message is that we are all in this together, and to encourage the people of Bermuda to make masks for their friends and families. The masks we made from items already at home, such as old bed sheets, pillowcases, and t-shirts, as long as they are 100% cotton. They've also circulated a how-to video, which will be circulated on social media to get the ball rolling, and this idea can be turned into a loose competition: who can make the most creative mask. This effort could go a long way back to bringing families back to basics, getting our basics, getting our seniors involved with their families, as most have had experience in sewing. Most importantly, it gets the community involved in doing something productive to help ourselves during these uncharted waters. This was a conversation that I held with the Chief Medical Officer earlier today about the emerging views and thoughts regarding masks which are being worn. Again, these are not for protection of healthcare workers, but there is a thought that if there may be asymptomatic carriers and if persons who are going outside have masks, it can help slow the transmission. It is an emerging area which we'll have more and detailed items for. I'm not sure if the Chief Medical Officer wants to speak to that anymore. No? Okay. Exactly. And so from that perspective, that's where we are. So I thank you for your question. It meant to be my remarks, but we are engaging the community in this effort. So in addition to that, from the Ministry of Public Works, there's also the effort to make sure that we can take care and feed the hungry and the seniors and the sick during this period.
I'm sorry if I didn't hear this, but maybe it was said. The vulnerable people that are up at Barclay, that's still going to be 24/7 once the full curfew's on?
The plan is to have the shelter at Barclay 24/7. We are excited to see our community come together. We have psychiatric nurses that were there. We have security detail that is there. We had members of the St. John's ambulance were there. We also had a medical doctor there. And so we see a safe environment where we have it, where people can come. We believe that it will be open during the period of the community protection plan for members of our vulnerable members in our community.
Just one final question about the going to the nearest grocery store, because I know some people get very technical. It's like the right next one, the one that's in your parish.
So we don't want people to overly complicate this. Okay. We do not want a mad rush and indisciplined behavior at our grocery stores. To make this easier, we believe it's simply to give people guidelines. If you live in the West, go to a grocery store in the West. If you live in the central parishes, go to a grocery store in the central parishes. If you live in the East, go to a grocery store in the eastern parishes. Do not make it any more complicated than that.
Thank you very much.
Students and parents next week, what's the process? A continuation of how they've been doing all this time?
Absolutely. The Minister of Education may give a further update to that. But given this has happened, schools clearly will not open next week. And as it was indicated, the schools will remain closed. There will be consultation regarding the online learning, which is taking place. But I want to commend those teachers, even though this is a school week break, but those teachers who have been creative and have continued to deliver learning for our students in the public school system during this time.
My last question, is there any, effects are you considering in consultation with the OTCs, amongst OTCs?
I will say the question is, are we consulting with other overseas territories? The answer is yes. And as I've said, we continue to work with our other overseas territories on this particular matter. The air bridge operation, which is being organized by the Foreign and Commonwealth Office, is to stop here, to stop at Cayman, and also to get persons back home to either the Turks and Caicos Islands, the British Virgin Islands, and others. So that work continues. As is the modern world, all overseas territories premiers have a WhatsApp chat group, and we engage in our WhatsApp chats and share the latest things of which are going on.
I'm glad you said that. There's an individual here that's a female that's stuck. She's from Jamaica, but supposedly she missed that last flight to go to Canada to Jamaica. As a matter of fact, she couldn't get on the flight because Canada didn't allow her coming through. She's stuck here in Bermuda. Are you aware of the situation?
I'm not aware of the situation, but I'm sure there's many situations. And what I would say is for those persons to contact the appropriate authorities. The fact is that the airport is closed, and it is unfortunate. But I can tell you that that person is not the only person in the world that is stranded. There are many people that are stranded. This is a challenge. We don't have pandemics very often, global pandemics on this scale. The last one happened 102 years ago. We are in uncharted territories. And I know that the decisions of which the government has made to this point in time have been difficult, but it is important, I think, that we respect the advice, respect the science. I did tell the Chief Medical Officer before this that if there were no specific questions for her, that I'm going to ask her to make a few comments. So, Chief Medical Officer, the microphone is yours. And I just would like to say that this woman has put a fine work and effort into making sure that the public health team is being led, and she deserves the entire country's gratitude as she works the twilight of her career. And she has been a voice of calm, a voice of reason, and someone who has continued to dictate the science to the Cabinet Bermuda.
Thank you, Premier. Well, I feel very touched by those words, but I have to confess, these decisions are not solely the decisions of the Chief Medical Officer. I have been very much supported by a team of very experienced and I would say extremely academic public health professionals, both in the Ministry of Health and throughout the community, because public health is really a very collaborative undertaking. And the Premier has done an excellent job, I think, of presenting the rationale for what is going to be a very difficult time. 14 days of sheltering at home is not something most of us have any experience in, but I think it's important to reassure the public that the decision was not taken lightly and that it is not a unilateral decision, but is supported both by local public health experts as well as the international advisors that we have, who give us a perspective on what is the best way to suppress the spread of COVID-19 in the community now. So the goal of all of these very severe measures is to stop person-to-person spread. There is a rationale behind the sacrifice that we're asking people to make. And so it is important that compliance is at the highest level. This is not a situation that we want to do in a halfway way. It requires a lot of sacrifice, and we want it to be meaningful. We want the outcome to be that the virus has been suppressed within our community for the period of time that we have been sheltering in place, so that we can get all aspects of prevention and control at its highest level, including testing capability at its highest level. And I think that if we all cooperate, if there's a large amount of compliance and honesty and solidarity, this period of hardship will be well worth it. So that's all I have to say, unless there are other questions.
What's the best thing you can say to the Bermudian people to make sure that this is only a 2-week period that we have to quarantine?
Well, in life and in public health, there are no guarantees ever. But the best advice I can say is that we look to other countries' experience over the last few months, and it appears very clear that the incubation period of the virus is 14 days maximum, and that while there are definitely asymptomatic carriers, people who don't get very sick or have very mild illness, the purpose is, if we can shelter in place, even those cases will subside, and we will not have individuals becoming unwell to a great extent. The other big part of making sure that this is effective is to really protect those who are most vulnerable, people who have pre-existing medical conditions or who are over the age of 60. Those individuals are more likely to become quite ill, and it is the goal of this suppression activity, this community protection action that is being taken to avoid that, to avoid people getting very sick. And that is the end game, really. This is a pandemic, so ultimately the virus will be quite widespread, but 80% of people will not have a significant consequence, will not be in hospital. And so our goal in this 14 days is to make sure that we optimize the chances that we will have the virus suppressed sufficiently, that those who are most vulnerable won't end up being in hospital and certainly won't be in intensive care. So it's a modest goal, but that is the reality in a pandemic.
Any other questions? Thank you.
In closing, I just want to reiterate the message of which was put out regarding the shelter in place. The Ministry of Health will be issuing guidelines, but this means that all activity as of Saturday at 6 a.m. must cease. It is difficult to shut down construction. It is difficult to shut down all these other items which make the economy work. But as it has been said, it is essential at this point in time to make our best efforts to save lives. And that is important. So I want to thank all of those persons and the public officers who stepped up to the plate, the public officers who are providing childcare services to our essential workers, which will continue, all those persons who are doing what is necessary and proper. The final thing is that the curfew exemption request has not changed, and people can access that form at coronavirus.gov.bm. The website is right here. There is a link to that particular form there, and you can go ahead and make your requests to be exempted from to have permission to travel during the shelter in place if you have special circumstances. But so we are clear, persons outside of the areas which have been outlined by the Minister of National Security will most likely not be considered. The objective of shelter in place is for minimal movement to allow our public health system to make sure that we can catch, contain, and control the future spread of this particular virus. I thank persons for their patience. I thank persons for their attention. I ask you to look out for the official guidance, which will be coming out tonight and over tomorrow, so you can understand. Do not rush. Do not panic. You have time to prepare. But once Saturday morning comes, let us all be inside of this together. It is incredibly important. Remember, it is a difficult time emotionally for many. So give that call to your friends, check in with them, and let's make sure as a community we can endure these next few weeks in a sense of unity and a sense of purpose, recognizing that we're sacrificing to save the lives of the vulnerable in our community. Thank you.